My name is Ann Burchell. I'm a scientist at the Ontario HIV Treatment Network. I also have an appointment as assistant professor at the Dalla Lana School of Public Health at the University of Toronto and adjunct professor at the Division of Cancer Epidemiology at McGill University. I'm going to be talking about cervical cancer, which is caused by a virus we now know, and that virus is human papillomavirus. So there's a few key messages that I'm hoping the audience will come away with. The first is that this is actually a very common virus. It's the most common sexually transmitted infection that there is, and it's very much an equal opportunity virus. Most people who are sexually active will get this virus. That can be a little frightening when you first hear that, but the good news is that the vast majority of women who get this infection will clear it naturally. Less than 1% would ever progress to cancer. And even more good news is that because we've learned that this cancer is caused by a virus, we've been able to develop good prevention tools. So there's now a safe and effective HPV vaccine that can prevent infection with this virus in the first place. And we also have an opportunity to improve the way that we test women for the presence of this virus or lesions that might be pre-cancer, so that we can detect if there's any problem there and have treatments and removal of any potentially precancerous tissues before it would ever go on to cancer. I think it's important to participate for a number of reasons. The first is that I'm part of community too. I'm a mother, I'm a daughter, I'm a family member of a cancer survivor. So I think it's really important to learn more about cancer and cancer research in a forum like this. Secondly, as a researcher, I think it's important to do cancer research in partnership with community. Researchers don't belong in an ivory tower. They need to be transparent about what they do and share their knowledge. And I also want to hear what members of the public think about cancer and cancer prevention, and we do this together. When people are thinking about cancer, and certainly when they're dealing with a cancer diagnosis, I think there's a lot of different ways that people react to that. And one of the ways that people might react is they want more information. It's a very common reaction. And one way to get information is from your doctor or from reading about it on the internet. A lot of times when you're reading about it, you have questions. And I think a forum like this is a place where you can ask more questions and hear what other people, hear their questions and what the answers are. It gives you an opportunity to have a dialogue with researchers that you might not otherwise have. And I think a lot of people might appreciate that opportunity.